The Knuckle Tip. The Knuckle Tip is an epical phaco tip that facilitates quick and safe operations. Here we see the Knuckle Tip. Unlike conventional tips, it has a unique configuration and amazing functional characteristics. The head of the tip has a round and smooth spherical configuration, making it safe even if it touches the posterior capsule during phacoemulsification. It rarely ruptures the posterior capsule. As the tip has a broad surface area, ultrasound energy can be effectively used to emulsify the nucleus. There is no sticking in the nucleus. When an infusion sleeve is attached, irrigation fluid comes mainly from the lateral ports. As the tip has a 20-degree bend, it moves effectively on the Neosonics handpiece. The smooth and rounded tip surface is so gentle that it can remove not only the nucleus, but also the epinucleus and cortex. The tip has a smooth and spherical design, which is both safe and efficient in phacoemulsification. The irrigation fluid flows out laterally from the side ports of the sleeve, helping to improve the followability of the nuclear fragments. As the tip is bent, it oscillates effectively on the Neosonics handpiece. In pulse mode at 60 pulses per second, the pre-chopped nucleus is quickly phacoemulsified. Since the tip does not stick in the nucleus, it appears as if the cataract disappears in front of the tip. In short burst mode, which usually requires longer irrigation time due to sticking of the nucleus at the phaco tip, the broad tip surface of the Knuckle Tip prevents sticking. As a result, phacoemulsification can be attained much more effectively and with a shorter irrigation time. In this case, the US time was only 0.6 seconds, and the average power was 4.6%. As the head of the tip has a very smooth and spherical finish, the same tip can also be used to remove the cortex and to polish the posterior capsule safely. It is not necessary to change the handpieces. Just by changing the setting of the phaco machine, the same tip can be used as an IA tip and a posterior capsule polisher. Before performing phacoemulsification, we divide the nucleus by phaco pre-chop. By this mechanical fracture, the process of nuclear grooving can be eliminated, and the merits of the Knuckle Tip can be markedly enhanced. The Knuckle Tip is most suitable for the phacoemulsification of the pre-chopped nucleus. Before performing phaco pre-chop, there are three important prerequisites. 1. To protect the corneal endothelium using dispersive viscoelastic material. 2. To make a complete capsulorhexis without tears or notches. And 3. To perform sufficient hydrodissection so that the nucleus can rotate freely in the capsular bag. This is a new hybrid combo pre-chopper. The angular side of the blade is placed at the center of the nucleus and inserted downwards for bisection. The rounded side is used to safely achieve complete division. By rotating and repeating the same procedures, the nucleus can be divided into smaller pieces to facilitate phacoemulsification. Those nuclei which can be pre-chopped by this technique are the best candidates for phacoemulsification using the Knuckle Tip. Once the nucleus has been divided into smaller pieces, subsequent phacoemulsification can be performed easily and rapidly using the Knuckle Tip. It is also possible to use this tip on a conventional ultrasonic handpiece that does not oscillate. With a harder nucleus, weak ciliary zonules, or incomplete capsulorhexis, the nucleus should be supported by the second instrument during insertion of the pre-chopper. A nucleus sustainer is used to reduce the stress on the capsular bag and ciliary zonules. As the new hybrid combo pre-chopper has a sharper angular blade, it can also be used in place of the conventional universal pre-chopper. The rounded side of the blade is so blunt that it can be used safely close to the posterior capsule. By making a third port in the micro sleeve, sufficient irrigation of the anterior chamber can be attained, even through a tight 2.6 millimeter incision. At the maximum setting of the dynamic rise +4, the aspiration flow rate reaches 100 cc's per minute instantaneously. Even at the highest vacuum setting of 650+ millimeter mercury, the anterior chamber can be stable because there is no sticking nor occluding of the tip port. The knuckle tip is suitable for phacoemulsification of a relatively soft nucleus. However, by pre-chopping the nucleus into smaller pieces, a grade 3 nucleus can be removed without any difficulties. For more than 12 years, we have performed phaco pre-chop before phacoemulsification. By dividing the nucleus by pre-chopping, the US time and energy required during the grooving process can be eliminated. However, some surgeons still prefer to perform the divide and conquer technique. By reducing the size of the knuckle, the tip is also suitable for this technique. During the grooving process, the oscillatory movement of the neosonics is disabled so that the groove may be narrow and deep. Aspiration flow rate and vacuum pressure are also set at lower levels. For phacoemulsification after pre-chopping the nucleus, a bigger knuckle is more efficient in reducing the US time and the energy required. However, for the divide and conquer technique, a smaller knuckle is suitable for making a deep and narrow groove for successful nuclear division. As the tip surface has a smooth finish, dividing procedures can be performed safely. Dividing the nucleus into 4 pieces provides the same resulting state as performing phaco pre-chop. By increasing the vacuum and aspiration flow rate to the maximum settings, each nuclear fragment is phacoemulsified easily and rapidly. As the tip has a broad surface area, it does not stick in the nucleus, and the US energy is effectively used for actual phacoemulsification. Without changing to the IA handpiece, the same tip and handpiece can be used to remove the cortex, just by changing the setting of the phaco machine. Extremely low ultrasound energy or oscillatory movement of the neosonics can be used to remove the lens epithelial cells, which are located at the equatorial portion of the capsular bag. As the tip is spherical and its surface has a mirror-polished smoothness, it is also possible to safely polish the posterior capsule. The knuckle tip is an epical phaco tip whose design is based on the new concept of phacoemulsification. It is most suitable for relatively soft nuclei. However, phaco pre-chop will enlarge the range of its indication. Its unique configuration has attained stick-free and very efficient nuclear emulsification safely and easily. The tip with a larger knuckle is most effective for pre-chopped nuclei, but a smaller knuckle can also be used in the conventional divide and conquer technique. The knuckle tip will make your cataract surgery much more simple, efficient, and safe. Thank you very much for your kind attention.